first of all the front-running vaccines require 2 doses. And they have to be separated by at least a week, in some cases 2 weeks. So the first thing is you've got to get 30,000 people or more and divide them between the placebo group and the vaccine group. And that's all blinded, and that has to be handled very carefully so that no one involved knows who's who. Then you give them their first vaccine. You wait 2 weeks, you come back, you give them the second vaccine. And then you wait for their natural exposure event. Are they or are they not in some location where there's a lot of COVID floating around and they're likely to get exposed? Then you compare, you bring all of them back, you look at all their data and you compare and see, did the vaccine work? Did it protect people? And you see that by virtue of comparing the placebo arm and the vaccine arm and saying, the vaccine arm got 10% less COVID or 100% less COVID. That is what you'd really like. Now, all of this takes time. And if a company still hasn't even enrolled 30,000 people for their study, they're certainly not going to be ready to start poking people in the arms real soon and wait 2 weeks for the next round. So just looking at the math and the timing, it's very, very hard to imagine how you get to Halloween with all your results done. In fact, the big meeting that has been announced for assessing available vaccines at FDA is October 22nd. So it's less time than waiting until November 1st. It's really close.
And Laurie, I mean, given what you have seen from the FDA and from other U.S. health agencies within the Trump administration over the course of this epidemic, do you think it's possible that they really are going to try to roll something out on November 1st for maximum political effect, even if it hasn't met the kind of thresholds you would expect in terms of safety and efficacy that the FDA would usually serve as a gatekeeper for? Do you think that the FDA would allow this to proceed in a way that wouldn't be safe?
Well, at least 2 top officials working inside the FDA, not the head of it, but below, have said they will resign if a vaccine is rolled out prematurely, where there's inadequate information to certify its safety and its efficacy. I just don't see how you can possibly get to November 1st just looking at where all the products are in the pipeline right now and say, yeah, we know it's safe. For one thing, there are many types of side effects associated with vaccines over the last 40 years that don't turn up right away. It may take some time to be noted. And more importantly, there are ones that statistically are so rare that a sample of 30,000 people would probably not statistically catch that side effect. For example, this paralyzing Guillain-Barré syndrome, which forced cessation of the 1976 swine flu influenza vaccination campaign ordered by President Gerald Ford, that appeared in 1 out of 10 million recipients. So a sample pool of 30,000 is very unlikely to spot something that rare.